there's a regulation that we had launched very recently that dictates responsible advertising for food and beverage. So if you drive across the Emirate of Abu Dhabi today, you're not going to see unhealthy food and beverage promotion anywhere on out-of-home media assets. This has been in effect since November. For Healthy Living is a whole-of-government program that brings together government entities, the private sector, communities, and individuals to, in essence, hardwire prevention and well-being across the Emirate of Abu Dhabi. And we're doing this by making system-level changes that influence people's daily lives so that it's easy and accessible for all citizens and residents across the Emirate of Abu Dhabi to be healthy. And our job as Healthy Living is not to force people to be healthy, but rather, as I said, make those system-level changes so that healthier living becomes the default choice across all the different settings and touch points in people's lives. So I like to use the example of mosques. So in Abu Dhabi, there's a target that wherever you live in the Emirate of Abu Dhabi, there should be a mosque within a 5 to 10 minute drive. We're adopting that same approach to fitness facilities, gyms, pools, pitches, courts, walkways, anything that enables people to be physically active. So having one or multiple of these, again, built closer to where people live. At the end of the day, it's your choice as an individual, how you want to live your life and what choices you make. And that is very important, that autonomy is at the core of how we think, and we ensure that is something, irrespective of what initiative or regulation or whatever we're doing, that is maintained, that people are free to make the choices that they want. The second part is we're not going to come off as quote-unquote militant public health promoters telling people, you have to be healthy and don't eat junk and don't smoke. People know this and they don't like to be lectured. It cannot and should not just be government. Right? It should be the government in partnership with the private sector, in partnership with communities, in partnership with individuals, and all of us together through different roles coming together to make health something that is hardwired across the society.